America's healthcare system has long been criticized as too fragmented, too expensive, and too complicated for most Americans to navigate. But now there's a better way to receive healthcare right here in Pennsylvania. It's the revolutionary new Health Navigator from Geisinger Health Plan. The Health Navigator service is based on a new model of healthcare that's sweeping the nation, known as the patient-centered medical home. It's healthcare that focuses on you, the patient, so you receive better care and are part of an entire team dedicated to your health and well-being. Your primary care physician is the quarterback of your personal healthcare team and works with office staff, a nurse case manager from Geisinger Health Plan, and of course, you and your family to design a plan of care that's right for you. Working together, we'll coordinate your care with hospitals, specialists, pharmacists, and nursing homes to provide you with total customized care. We'll make sure you get the preventive care you need, whether it's a checkup, a flu shot, or preventive screening. And if your health situation is more complicated, the case manager will work closely with all team members to create a plan of care that will help you and your family manage the health care issue and know when to contact us for assistance.
Jennifer called me and she told me she was the case manager, and if there was anything that I needed, she'd help me out. And believe you me, she did. I was thrilled.
Only Health Navigator has these special features to ensure you get the care you need when you need it. Special 24-hour phone numbers for the doctor's office and nurse. Same-day appointments for urgent care. The staff will help arrange for various services like Meals on Wheels, Area Agency on Aging, and light housekeeping if appropriate. We help you understand your medications, how to take them, and what alternatives are available. We help you understand your prescription coverage. For example, if you have Medicare Part D prescription coverage and you reach the so-called donut hole, we help you explore options to obtain the prescriptions you need.
I had a couple bouts of shortness of breath, and we were trying to get it regulated. So I know she had conferred with the doctor on other things I had called about, so I knew that she would probably handle this. Well, within 2 hours of my calling her, she called me back. And everything since that has been wonderful.
The real purpose of moving case management out to primary care was that the case manager needed to be part of primary care and not seen as just an extension of the health plan. And they really do work very collaboratively in the sites with patients, but also with the team, the providers, the nurses, the front desk people, and they really become part of that actual practice team.
The results of this new approach were remarkable. Members received better care and experienced better results.
Every day I've dealt with patients who, maybe they've been in the hospital 10 times in the past 6 months, and once we get involved as a case manager, they don't have hospitalizations, or their hospitalizations, they may still have 1 or 2 just because they are so very sick, but they decrease so much.
Really excellent case managers, and they have the personality, and the patients have embraced their input probably more even than the physicians have. And when you have a patient that's really sick and you can go in and get your case manager and say, she's in heart failure, I don't want to send her to the emergency room, she needs a hospital bed at home, she needs physical therapy at home. The case manager jumps in and does all that.
The Health Navigator's high level of personal care also leads to close personal bonding between patients, family members, and their healthcare providers, giving support, education, and resources even when times are at their most difficult.
My husband was receiving treatment from Dr. Kowalinsky, and I was introduced at that time to Jennifer Jakota, who it turned out to be an angel in disguise. Jen would call the home frequently because my husband's illness was quite serious at that time. He had emphysema very badly and only 1 lung. Jen would go through different things that would be options for us. She made this visit into a friendship, and we came to love her dearly, so that she was my lifeline to sanity on many occasions. And no matter what came up, I knew I could call her, and she was always there.
I love my patients. I love them. We delve deeper into, what's happening in the home. We get to know that these patients have a husband they've been married to for 50 years, that they have kids, they have grandkids, great-grandkids. We get to know them on a more personal level. And that allows them to feel more, closer to us. It allows that bond to kind of grow. So it's not just about their health care, it's about all aspects of their care. It's about the entire patient.
The calls that I received, just checking, it just made me feel like I wasn't alone. I knew I had somebody there that would always help me, even if it just meant talking. And I wanted the best for my husband, and he got that.
The Geisinger Health Plan Health Navigator, an innovative program that puts you at the center of your health care. Only from Geisinger Health Plan.
This has been just the absolute best thing that I've ever been involved with.